All right, so today we're going to dig into the question of why is health insurance so expensive? And, there is no easy answer for a question like that, but there are a few things that we can definitely point to that have caused health insurance costs to be so high. And so it is really a multifaceted thing when you look at facilities fees and you look at provider fees and prescription and malpractice. We live in a society where there are a lot of lawsuits, and so all of these things play into the cost of health insurance. But more than anything, there are a couple of areas where costs have gone unchecked and are out of control. And one area is pharmacy. The cost of medication and prescription and pharmaceuticals, cancer treatment. This list goes on and on and on. But when you look at the cost of health insurance, the insurance companies have to bear the cost of those prescriptions. There's law that dictates to the insurance companies that they have to pay negotiated rates for those brand name and specialty pharmaceuticals. So that the cost of prescriptions and the cost of medications in today's health care environment is the one area where it's gone unchecked, and it's driving a lot of the cost of health insurance. And another area that we can point to that has caused health insurance costs to rise. When the Affordable Care Act was passed, that was the line in the sand when we started to see health insurance costs rise across the board. And the main reason is because there's law that mandates insurance policies offered through the marketplace have free preventive services. And so, nothing is free. The costs will be borne somewhere. Somebody's going to have to pay those costs. And all marketplace, all Affordable Care Act insurance policies have to have a laundry list of free preventive services. Immunizations, free colonoscopy, free mammogram. And so that one event, as big a contributor to the cost of health insurance as anything else that's happened, in the last 15 years. So the cost of health insurance has gotten out of control, and, there are a couple of things that I can point to that have really impacted that in the last couple of decades. Number one, the Affordable Care Act. The Affordable Care Act and all the free preventive services that are contained within those insurance policies, and then pharmacy. Those two things have contributed more cost to health insurance plans than any other of the variables. And so that's why I have a job. That's why we and our agency, have so many clients, is because we can navigate those expenses and we can find the most affordable ways to give the consumer the best protection out there. And so the BBS insurance strategy, working with an agent who is an expert in this field, will help you save money and get better coverage. So I want to thank you for watching. If you have any questions, please leave them in the comments. I'd also ask that you like and subscribe to our YouTube channel. I will say, though, that designing a health insurance package is a very intimate discussion, and so the best way for us to help you is for you to talk to us directly. You can call the number on the screen, or you can reach out to us at bbs-insurance.com, and we will design a health insurance package specific to you and your needs.